All right. Hey, everybody, and welcome back for another deep dive. This time we're tackling something that I think a lot of people get
Yeah.
nervous about, nursing assistant interviews. We actually got a great guide sent to us by a listener called 2025 Nursing Assistant Interview Questions and Answers, which I gotta say, I wish I had this when I was first starting out.
Nice.
But going through this, it really struck me that it's not just about spitting back medical terms and procedures. They really want to get to know you as a person.
Yeah, I think that's so important. The role of a nursing assistant is so hands-on. You're working with patients who are often in really vulnerable situations. It's not just about the skills. You need to have the right temperament, the empathy, the resilience to really thrive in that kind of environment.
You know what? That makes me think back to my first hospital rotation. And honestly, it wasn't the medical stuff that threw me off. It was dealing with patients who were, scared or frustrated, even just grumpy. It's a whole other skill set, isn't it?
Yeah. It is. It
Yeah.
really is. And this guide actually digs deep into those soft skills, which we know are anything but soft in the real world. They're essential. And it breaks down all these different types of questions you might encounter. And like you said, it's not just about clinical knowledge.
Okay.
It's behavioral questions,
Yeah.
scenarios, even questions about your work ethic and your communication style.
So let's dive into some of these questions. Give me like a challenging one, something that really separates the great nursing assistants from the good ones.
Okay, how about this? How would you handle a situation where a patient refuses care,
Hmm.
even if it's in their best interest?
Ooh, that's a good one. And you can't just, force them. You have to respect their wishes.
Right.
But what if their refusal, could actually harm them?
Exactly. That's where those communication skills become so crucial.
Hmm.
And this guide really emphasizes finding that balance. It's not about telling the patient what to do. It's about explaining the risks and the benefits clearly
Okay.
and respectfully. You have to understand their perspective, even if you don't agree with it.
So I'm imagining a scenario. Okay. Let's say a patient's refusing to take their meds. What would be a good way to approach that?
So the guide actually gives this really helpful example. Let's say the patient is, worried about side effects. Instead of dismissing their concerns, you acknowledge them.
Okay.
You say something like, I understand you're worried about the side effects. That's completely valid. Let's talk about what those might be and how we can manage them. Would you be open to hearing more about that?
That's interesting. So you're not starting a debate, you're starting a conversation. You're like partnering with them, not dictating to them.
Exactly. And sometimes, even if you do everything right, they might still refuse. And in those cases, you document the conversation. Inform the nurse in charge and respect the patient's decision.
It sounds like you need this mix of confidence and sensitivity to handle those tough situations.
Yeah.
What other qualities does this guide highlight as being, super important for nursing assistants?
One that often gets overlooked is attention to detail. It sounds basic, but in healthcare, those little details
Oh, I bet.
can have huge EE consequences.
Give me an example of why attention to detail is so important.
The guide gives this kind of chilling example
Okay.
where a nursing assistant was prepping medications for a patient, but they didn't double-check the dosage. It was a simple mistake, but it could have been disastrous.
Oh, wow.
Luckily, the nurse caught it, but it just highlights how crucial those details are.
It's like a powerful reminder that you can't be on autopilot in this job. Every action, every observation matters.
Exactly. It's
Yeah.
about being present, engaged, and super alert. And it's not just about preventing errors. It's about noticing those subtle changes in a patient's condition that other people might miss. Maybe they're not eating as much, or they seem withdrawn. Those little cues can be early warning signs that something is wrong. And you're often the first line of defense.
So you're not just carrying out tasks, you're constantly observing, assessing, advocating for your patients. It's like being a detective and a caregiver rolled into one.
That's a great way to put it. And that brings us to another crucial quality: physical and emotional stamina.
Okay, let's break that down. What makes it so physically demanding?
You're on your feet most of the day, lifting and moving patients, assisting with personal care, constantly on the go. It requires a good level of fitness and endurance.
Definitely not a desk job. But what about the emotional stamina part?
That's equally important. You're dealing with people who are sick, injured, often in pain. You're witnessing their struggles, their anxieties, sometimes even their grief. And it can take a toll on you emotionally.
Yeah, I can imagine you're constantly giving of yourself, physically and emotionally.
Exactly. And that's why it's so important to have coping mechanisms, to know how to de-stress and recharge. And the guide emphasizes that having a supportive team can make all the difference.
Oh, for sure. It's like that saying, you can't pour from an empty cup. You got to take care of yourself to take care of others.
Exactly. And that's something you can even ask about during the interview.
Oh, good point. We're going to get to those questions. But before we move on, I want to circle back to something you said earlier about patient autonomy. Can you elaborate on what that looks like in practice?
Sure. It basically means respecting the patient's right to make decisions about their own care, even if those decisions aren't what you or the medical team might recommend.
So even if I strongly believe a patient should do something, like take their meds, I can't force them.
Right. You can educate them, you can advocate for them, but ultimately the decision is theirs. The guide actually gives a really insightful example about a patient who refused a blood transfusion because of their religious beliefs.
Oh, wow. That's a tough situation.
It was, but the nursing assistant in the story respected the patient's wishes, documented the refusal, made sure the doctor was aware. It's about honoring their autonomy even when it's difficult.
That's a powerful reminder that this job is about more than just following orders. It's about advocating for your patients and respecting their choices, even when they're hard. Okay, so we've talked about the tough questions they might ask you. But what about the questions you should be asking them? I am dying to know what this guide has for that.
Well, this whole interview thing, it's starting to feel less like a grilling and more like a chance for you to see if the place is a good fit for you.
You know what? You're so right.
Yeah.
Because you are bringing a lot to the table.
Exactly.
Yeah.
And this guide, it have a whole section on questions you should ask.
Okay.
Not just to impress them, but to really get a feel for the work environment.
Hit me with a question that will make them sit up and take notice.
Cool.
Something that shows I'm not just, desperate for any job, but that I'm actually thinking about, like the bigger picture.
How about this? How does the facility support ongoing training and professional development for nursing assistants?
Ooh, I like that. Shows you're ambitious, you're eager to learn,
Mm-hmm.
not just content with the bare minimum.
Exactly.
Yeah.
It also signals that you're thinking long-term about growing within the role and staying up to date.
Mm.
Because this field, it's constantly evolving.
Okay, yeah. Plus, it gives you insight into how much they invest in their staff.
Right.
Do they offer tuition reimbursement, mentorship programs? It's a way to see how committed they are to their employees' growth.
It's like you're saying, hey, I'm here to learn and contribute, but I also want to know that you're invested in my success.
Exactly.
Here's another question that stood out to me from the guide. What are some of the biggest challenges the nursing assistant team faces here?
Mm.
And how does the facility support them through those challenges?
That's interesting. It's almost like flipping the script on that typical "what are your weaknesses?"
Right.
question.
Right.
You're acknowledging there will be tough times, but you want to know how they handle them as a team.
It shows that you're not naive about the demands of the job
Mm-hmm.
and that you're proactive about seeking support when you need it.
You get some valuable insight into the work culture.
Yeah, absolutely. Do they have a strong support system? Open communication? Do they value teamwork and collaboration? You can learn a lot from their answer.
It's like taking the temperature of the whole work environment. Are they all about individual heroism? Or do they get that a strong, supportive team is key?
You got it. Now let's get a little more practical. The guide suggests asking about the patient-to-staff ratio.
Ooh, that's a good one. Shows you're thinking about the workload and whether it's realistic to provide good care.
Exactly. And it can be a red flag if they get all evasive or defensive.
Yeah.
A good facility, one that's committed to quality, will be transparent about staffing.
It's about finding that balance, between challenging yourself and setting yourself up for success.
You don't want to be thrown in the deep end without support.
Exactly. And speaking of support, the guide also mentions asking about work-life balance. Now, that might seem a little forward, but it's actually smart, especially in a field like healthcare.
Yeah, I think a lot of people, especially when they're new to a field, they hesitate to ask about work-life balance because they don't want to seem demanding or uncommitted.
Right.
But burnout is huge in healthcare. And a good facility, one that cares about its staff, will understand that you need some work-life balance.
You're thinking long-term about a fulfilling career without sacrificing your personal life.
And it shows that you value your time and energy, which, let's be honest, are valuable commodities.
For sure. It's not selfish to want a job where you can thrive both personally and professionally.
Exactly. The guide even suggests how to phrase it. Instead of directly asking about time off or scheduling, you could say something like, how does the facility promote a positive work environment? and support a healthy work-life balance for its staff.
That's much better. It's not just about you, it's about the culture for everyone.
Now, one final question I thought was insightful, especially for someone just starting out. They recommend asking about opportunities for career advancement.
Oh, that's a classic. But it never hurts to ask. Shows you're ambitious, and you're thinking about the future.
It gives you a sense of whether they invest in their employees' growth. Do they have clear pathways for advancement, tuition reimbursement for further education? Do they promote from within? Those are all good signs.
You know what I love about all these questions? It's not just about getting information. It's about showing how thoughtful you are, how prepared you are, and that you're genuinely interested in finding the right fit.
It's like you're interviewing them as much as they're interviewing you.
Exactly, a two-way street. And by asking these questions, you're not just showing how smart you are, but you're also getting valuable info to help you decide if this place aligns with your values and goals.
So we've covered a lot of ground here, from those tricky behavioral questions to how you can really take charge by asking the right questions. I feel like we've given our listener a real advantage.
I agree, but I think it's important to remember that while this guide gives a great foundation, you got to bring your own personality and experiences to the table. It's so true. It's about being your authentic self, showcasing your passion for caring for others, and your commitment to excellence.
Because those qualities, at the end of the day, those are what really make a great nursing assistant. You know, through all of this, I keep thinking back to something the guide said about the core values of a nursing assistant. It wasn't just about, like, skills. It was about really having a heart for this work.
It's true. You can teach the technical skills, but that genuine desire to care for others, that's something special. And I think that comes through in a good interview.
It's like they're looking for that spark that says, this person's not just here for a paycheck. They actually want to make a difference.
Exactly. And I think if you're really passionate about this work, that passion will be contagious. It'll show in how you answer questions, your body language, your energy.
I remember that story in the guide about the nursing assistant who went above and beyond for a patient who was feeling lonely. She just sat and chatted with him, learned about his life, made him feel seen. It wasn't a medical procedure, but it made a huge difference to him. That's what I'm talking about.
Yeah.
Those small acts of kindness, those human connections, they mean so much. And you can't teach that. It comes from empathy and compassion.
It's like you're not just caring for their physical needs, you're caring for their spirit too.
Exactly. And that's what makes this role so rewarding. You have the chance to make a real difference in people's lives, to bring them comfort, ease their pain, be there for them.
You know, as we wrap up, I have to go back to that question you asked earlier about imagining your first day and the impact you want to have. It really gets to the heart of why we choose this path.
It does. And it's a question worth asking yourself throughout your career. Because as you gain experience, face new challenges, see the ups and downs of healthcare, your answer might change.
It's like a compass, pointing you back to your purpose, reminding you why you're here.
Exactly. So as you go into that interview and start this journey as a nursing assistant, hold on to that question. Let it guide your actions, inspire your compassion, and fuel your commitment to giving amazing care.
And hey, remember, we're rooting for you every step of the way. Go out there and shine. Can't wait to hear how it goes. That's it for this deep dive. Until next time, keep learning, keep growing, and keep diving deep.